All right, so today we have the delivery of these lower zirconia crowns, 1200 megapascals of strength. This is what we call a full mouth rehabilitation of the lower. We're going to be doing the upper soon, but first we wanted to do the lower because this patient had worn down his lower teeth a ton. And you can see like that height right there, that's where he had lowered, that's where he'd ground his teeth down to. We did have to prep on the buccal and the lingual surfaces, but we didn't do any occlusal reduction. That was how much reduction he had done himself over the years. So you can see these crowns really are going to be building his bite back up. He's going to have some getting used to the new VDO because it's going to be stretching out his masseter muscles a little bit. So I've already gone over that with him, that it's going to be a learning curve to talk and eat again. And we're definitely going to want to make him a mouth guard, and he's probably going to need quite a few adjustment appointments to get the bite dialed in. We got an implant resting over here. It's a Neodent GM Helix implant resting in the bone. It's been there for about a month. And after another month, we'll go ahead, take the healing abutment off, affix a scan body, scan him, and then get a crown there. So you can see how this is all going to fit together. These uppers need to be prepped as well, but that's not until after we've done the lower. Can you do everything at once? Yes. I just prefer to do upper first and then lower, or in this case, lower first and then upper. I find it's more predictable, and it's maybe less of a shock to the patient, you know, when they get their new teeth and it's like we've opened the VDO almost instantly this much. This kind of gives their muscles time to stretch out because we opened the VDO a little bit with the lowers, and then after today his bite's going to be wonky. We're going to put some composite on the tops to kind of balance things out a little bit because I had the lab build this lower plane of occlusion to ideal. You know, as you can see, it's pretty flat. The curve of spee is not insanely deep. There's a little bit of a curve of spee there, but there's no irregularities. Whereas we look at his upper teeth, you can see there's hills, there's valleys, there's, you know, odd wear spots. So he's only going to have like maybe a couple, 3 points of contact, something like that, when we put his uppers on. We put his lowers on, I should say. So we're going to put some composite to make some stops basically, so that he can be a little more comfortable until we get him back to prepare his upper teeth. So anyway, I will give some updates on that as we go along, but wanted to kind of show the preliminary where we're at right now with it. So we'll see you guys in the next one. Thank you. And here's today's result. Come back to see the final result next time.